Okay, we're going live, guys. We're live. Yeah, yeah. Last time I didn't check. I should have just. Last time I didn't wait and check. So the live icon that's come up. That's come up. So now I know that I'm live properly. Okay, morning everybody. Morning everyone. Going live. Apologies for the delay. But we're gonna get straight into it. We're gonna do some lower leg stuff. There was a question about the wrist that we're going to do as well, because the wrist and the ankle, the test and the assessments are exactly the same. So we're gonna do some stuff there.
Someone's asking for the link for the live.
Go to Genesis, go to Facebook, and then go to Genesis Sports Massage. Go to Genesis Fitness Sports Massage. Yeah, there's going to be a live link on YouTube as well. So the YouTube is going to be live as well. Okay, so we've got somebody here, a player. We're going to do some assessments on him. So I'm going to demonstrate some lower leg tests. So if you lay down on your back, right, lay down on your back. We're going to do some assessments with lower leg. So with assessing the lower leg, palm of the hand on the knee to here. Something that I haven't done is looking for, with the meniscus, any tears or any grinding or any cartilage issues. Yeah, we're moving the leg in like a semicircle kind of motion. We're going backwards and forwards, and as you're doing that, you're looking for any grinding or any rubbing of the joint. Yeah, so if I come round to this side so people can see if that's a better angle, we're going to do semicircle movements, and as you're doing that, the tib fib underneath the kneecap is going to be rotating, and if there's any cartilage problems, you'll get that grinding kind of feeling or sensation, and you'll feel that cartilage rubbing. Yeah?
Just a test or anything?
That's just it's a way of assessing.
Okay. And is there a name for it?
No, it's just you're just doing menisci test, menisci assessment. So that semicircle kind of movement there where you're rubbing. Okay. So just in case some people have missed it, I'm going to take my elbow. We're going to do anterior draw. I'm going to put my elbow there, here, and I'm going to put my hands.
It's not something's not working on the leg. Is the top one?
Yeah. Top one. The bottom one is the Facebook one. Can't see?
Bottom one is come off the screen. I think maybe that's the one they're referring to. They said the link was interrupted. So I don't think they can see it. Ina and some Ria Tequila. Oh, Natalie and Dina.
What is that porridge with cow's milk?
Right now.
Is it stopped? Okay.
The whole almond milk thing. When I'm proper eating healthy, that's what I'll do.
Yeah.
It's winter, man.
Yeah, I hear that.
Then summer comes, that's when I start eating properly.
Why does it come off? Ow.
I don't even like calming that much in it because it's on my stomach after. Like, I realised after that when I stopped drinking it.
You felt the difference.
Yeah, yeah.
The bloody thing's flipped. The screen. Going live.
Guys, this is a short commercial break. We'll be taking two.
Come on. Oh, it's flipped back round. Come on, come on, come on.
Ah.
That one's recording.
So what days do you do the PE?
Mondays and Thursdays.
Okay.
Yeah.
Okay.
School in Edmonton.
School in Edmonton? Just the PE?
Okay. We're back again. Oh, you know what? Let's rotate it so that it's.
I'm teaching football next time.
Is it?
I think if I
What
do
is
it
it,
that
primary
way, then I can.
Primary, yeah.
I can.
Primary?
Okay.
Yeah, but obviously,
I've worked in-
sports massages, they make a lot. Because obviously, like, you charge
Okay, we're live again, guys.
£50 a session, innit?
We're live again.
But you
So if I
gotta
flip it
gotta
that
leave
way,
until you get proper, like,
Then I
job
can
security.
see. I can see.
If I get a job in a club or something,
Yeah.
or with a sign to someone.
Okay. Okay, so I can see now. So if I lift the leg like that and then I put my knee around and hold on and I'm gently pulling the leg forward, anterior draw. Yeah? Let's position the camera. Shall we- Position it like that. Is that better?
Yeah.
Is that a better position? I'm moving the camera again. You know what? It's better there, you know. If it's there. Sorry, so I'm just gonna move that. I think that's like the best. I think that's the best angle right there. Yeah. So I'm doing that anterior draw. Yeah.
Yeah.
And I'm gonna do. They can see. So again, if I use if I lift the leg, if I use the other hand and do it with the other hand, and then I'm going to do semicircular motions like that. Going to do semicircular motions that way. So as I'm doing that semicircular arc, you're listening and hearing for grinding inside the joint where there's any cartilage rubbing. Yeah? Okay. So if we do as well, we're going to do Faber test, right? If we move the bed that way, so I'm going to move the bed. Let's move the bed so that the bed is facing. So the bed is facing that way. Yeah. So if you lay on your head, yeah, you're on your back, looking up at the ceiling. Okay. So if I do that number 4 and I cross over, I'm going to push down there and I'm going to push down on the hip. So it's opposite hip to opposite knee and we're looking for tightness. We're looking for tightness. Yeah, opposite leg to opposite knee. We're looking for tightness. Okay. And also as well, there's with Murray, we're doing pushing the knee towards the middle and straightening. So pushing the knee towards the middle and straightening. And then also we're going to do a clock face. Position 1, position 2, position 3 and position 4. Yeah? So we're going to do position 1, position 2, position 3, and we're going to do position 4. Let me change the angle of my body positioning. If this is better, position 1, position 2, position 3, and position 4. Yeah? If you hold, can you hold this? So it's kind of like, hold it so that it's like, kind of, yeah, so that it's down like that.
What, are you filming the top one on? Because that's not going to be able to see it.
Oh, the top one. Yeah. Yeah. So again, I'm going to show you from a different angle. So we're going to go 1, 2, 3, and we're going to go. My shoulder's blocking. Try and come. Can you do it like this so that my shoulder's not blocking? So we're gonna go 1, 2, 3, and 4. Yeah. So I've done this test.
That's not mine.
Faber's test. I've done Murray, pushing the knee in. Yeah. I've done semicircle menisci test. And then I've done Fade, which is position 1, position 2, position 3, and position 4. Okay? Does anybody want to see those tests again? Comments, please. So I've done four different tests. Does anybody want to see those 4 again?
Speak, people.
Yeah. So if we put it back there.
Feel like a cameraman.
Yeah.
Yeah, that angle's good. Is that a good angle?
Yeah, clock face again. Yeah, it's correct. Clock face.
That's clock face.
Yeah, clock face. Call it. There's Faber and Fadir. F-A-D-D-I-R, or some people call it clock face, because you've got the clock face and you're pushing the knee in 4 different directions. Yeah? So you can call it clock face or you can call it Fadir. Yeah? This one is called Faber. Faber. F-A-B-E-R. Yeah? Some people call it the Patrick's test as well. Yeah.
You know when you're just going through the test quickly, can you
Yeah.
just go through exactly what you're testing for? Just make it clear.
Yeah. So what
that,
we're testing
like,
for.
The actual joint and
Yeah.
what the tightness we're looking for.
Okay. So with the Faber-Patrick's test, I'm looking for the opposite hip. Here, I'm looking for tightness, and I'm looking for movement and tightness as I'm pushing down. Yeah, hip, TFL here. And then to test the opposite leg, hip, TFL. Yeah, that's what I'm looking for with Faber-Patrick's test. Yeah. The menisci one, where I'm holding the knee and I'm doing semicircular, that's a menisci test, and I'm listening for any grinding sound or any crunching sound of any cartilage or menisci on the knee. That's what I'm looking for. That's what I'm listening for. Yeah? McMurray, I'm looking for instability in the medial and the lateral side of the knee. So I'm getting the knee, I'm pushing it towards the middle of the leg, and then I'm letting it come down and straighten. And I'm looking for, as I'm pushing, I'm looking for any resistance against me, or I'm looking for any clicking movement. That if it's not smooth, then I'm looking for that clicking as I'm pushing the knee.
So instability.
Yeah, instability. That's McMurray.
Of knee.
Yeah.
And then clock face is.
The clock face is I'm looking for any sign from the player or from the individual pain. So I'm pushing it in that I'm pushing it in the top left corner.
So it's more like client's response.
Yeah, client's response. Top left corner, top right corner,
bottom left,
bottom left, bottom right. Yeah? So I'm pushing the knee, I'm holding the knee at that right angle position, and I'm pushing it in each full corner to get a response.
Can I just try them quickly?
Yeah, try that.
So. Faber's test.
Yeah.
This guy.
Hold it more, yeah.
Underneath.
So, no, this hand here. Yeah, on top of the knee. So, no, like that, yeah. And then you're doing semicircle.
Then we've got McMurray.
We've got McMurray.
Same, hold it the same way.
Yeah.
So
And
in.
then, yeah. Done.
Okay.
Do it again. Do it again. Do it again.
What would you see if it was?
What I would look to see is,
Yeah.
as you're doing that and you're bending it,
Yeah.
I'm looking to see if the person's resisting, pushing against you, or
Am I
if
holding it right?
yeah. So you have to try and like, what you got to do is like that.
So
Yeah.
push.
And then what I'm looking for, as you're going down,
Yeah.
if the leg is like
Yeah. That was a little bit.
a little bit, yeah.
Yeah.
So that might even be with the instability and the compensation.
Yeah. And
Yeah.
again, it's the instability of the knee, isn't it? And
Yeah.
then clock face.
Yeah, corner over to me more. Yeah. No, bottom towards you more.
Oh. Alright.
More towards you even.
Alright.
Yeah. And then yeah.
Coolio.
Yeah. Okay.
Yeah.
Somebody was the point camera was the 4 point called. Okay. Right. So we've got them 4. Yeah? Okay, let me, you know what, let me turn this around so that it's